We're already on our disaster mode at the time, which means that you try to move patients out that can be moved out. You try to get additional staff if you need it. We reorganize things a little bit so that we're ready to evaluate and triage patients at the back door in the ambulance breezeway. Basically, you have a lot of periods of anxiety where you wait for somebody to come in, and then you usually get sort of a bolus of ambulances that show up and unload patients. So then there's a flurry of activity followed by waiting for the next round. And basically we had the private vehicles or police cars. Basically the patients very highly covered with mud, dirt, and so on when you think about the tornado picking up soil and whatever other debris and accelerating it to a couple hundred miles an hour and sandblasting people, plus they're already wet from the rain and so on. They're just completely caked with mud and soil. And most of them have a lot of soft tissue injuries, a lot of wounds, but a fair number had long bone fractures. Some of those had bone sticking out or open fractures. And our more serious patients had head injuries of various kinds. As those patients came in, a nurse partner and I would receive them, reevaluate, and then do a triage categorization. They were either really sick or immediates, and code them red. They were people who could be delayed just a little bit in getting care. They're coded yellow. And then there are those people who are essentially walking wounded, and they're greens. And depending on that triage categorization, they go to a different location in the hospital for treatment. Reds and yellows come to the emergency department. And then